On January 7, 2020, Chinese authorities identified a new type of coronavirus, now termed COVID-19, from a cluster of pneumonia cases in Wuhan City, Hubei Province in China. On January 30th, the Director General of the World Health Organization declared the outbreak of COVID-19 a public health emergency of international concern. We sat down with officials from the Ministry of Health to get an update on COVID-19 in a local context.
COVID-19 is another respiratory disease. It's an influenza-like disease. It comes from a family of coronavirus, which we already have under surveillance. It's just that this is a new coronavirus.
Health officials stress that while COVID-19 has created international panic, the main concern is the novelty of COVID-19 and not necessarily the severity of the virus.
What constitutes an illness of a public health emergency of international concern is when you start seeing that the illness in itself is starting to spread rapidly, or it's an unknown source, it's something new to us, and it starts moving because of travel, it starts affecting travel, it starts affecting trade. So when things like that comes out, it's not necessarily because an increase of fatalities, but it's more because it's affecting how travel and movement is happening.
The scary part of it is not knowing, but as more data is made available, the evidence mounts. And so far we know that COVID is not as fatal as other respiratory events.
Under the epidemiology unit in the Ministry of Health, surveillance officers monitor the trends of diseases within the country. Their three main functions are to detect, contain, and manage infectious diseases such as COVID-19. Surveillance officer Ms. Lorna Perez walks us through this process.
So in regards to COVID-19, once we hear a rumor, and our investigation will try to find out, when I am talking about validating, is it worth following up? So we have to look at our case definition, what is a person under investigation criteria, what criteria are there to warrant that investigation. So we look at the travel history, which is the most essential part now because it's not in country yet. Once we recommend, as I said, for you to be in isolation, and once you remain in isolation for those 14 days, we do daily monitoring, which means we check with you every day to see if you're not developing any fever, any cough, any shortness of breath, or any other respiratory problems that the person might start with. If during those 14 days nothing happens, you remain healthy, there is no problem, then the ministry gives you the all clear.
If a person does show symptoms, the process changes to ensure the well-being of the individual and the public.
First of all, we screen you to see if there is something else there. If we test you for any influenza and we do detect any influenza, and depending on the risk assessment that we do to see how much risk you have, then okay, we know this is just the influenza. We will monitor you still for the 14 days to see if any worsening of the symptoms happen, or if you get over that for 2-3 days and then you start again, then we go through the same process.
Recently, 2 medical laboratory technologists from the Central Medical Laboratory participated in a 2-day training in Mexico. Upon returning, these laboratory technologists passed on the knowledge they brought with them by conducting an in-house training at the Central Medical Laboratory. Belize now has the capacity to test for COVID-19 in country.
Before we had the capacity to screen for that particular, we had the option that was made available to us is for us to send our samples to CDC, and they would have tested it for us and then send it back to us. But now we already have the in-house capacity to do it, and so the test should be out fairly quickly. If we get a case of COVID among all the other viruses that are circulating, it's our ability to detect it. We know at this point it has to be imported, so we're tightening our grip on the importation part.
COVID-19 is evolving every day as scientists get a better understanding of the virus. New evidence suggests that people can carry the virus without showing any symptoms. What do these new developments mean for Belize?
The entire region of the Caribbean, Central America is still low risk. We have had no confirmed cases. Like ours, all the areas in the region are still doing their heightened surveillance. They're screening for potential individuals under investigation. And to date, no confirmed cases. Like all other strains of influenza, it will affect us. It will eventually make its way here. We really can't say when, but like all other strains, it still has to come around this way. I guess for us right now, the preparatory phase is practically over. We do know what should have been in place, and at this point, we're now responding to, in the event now that it comes, how readily we are. I mean, the region itself have revised their plans. We're now at the point that we have isolation areas in those places for severe cases. We're still managing cases that are mild if they should come. Of course, we're encouraging that those will be home care. But by home care, it means that we're still following up with them. We're still going to follow up and make sure that they're okay by phone call, visiting them. But the more severe cases, just like any influenza that can become complicated, needs to be admitted to the hospital, and that care is given at that point.
It's important to note that while COVID-19 will likely make its way to Belize, there are ways to prevent the spread of the virus.
There are certain things you cannot avoid, but there are certain things you could do to prevent. And one of those things, as I said, is hand hygiene. Just wash your hands as often as possible. If you're on the move and you have a hand sanitizer, an alcohol-based hand sanitizer is what is recommended, and do that. And if you have to cough or sneeze, do it in your sleeve or cover your mouth with a tissue or something and dispose of it adequately.
And finally, Ms. Perez makes one last plea to the public during these days of uncertainty.
We still want to recommend the respect of people's privacy. Before you spread anything or you repeat what you hear, find out first. It's very damaging to persons who undergo this stigma and the comments that people put on social media, because it's a human being you're dealing with. They already have the fear of, okay, what if I do develop symptoms? And again, as I said, not necessarily has to be a Chinese national. We have our own Belizean students, we have our own Belizean officials who, for purposes of their jobs or their studies, have to be out there, and they want to come home, they want to see their family. I would like to appeal then for, people look at the human side of things.
The official outlets for accurate updates are the Facebook pages of the Ministry of Health, the Office of the Director of Health Services, and the Government Press Office. For Belize Now, this is the Habet.